Hey guys, I'm Kelly, the nurse who questions. And today I want to talk about something that makes a lot of people uncomfortable. Weird, because once you see it, you can't unsee it. We spend so much time being angry at the hospitals that we work for. And I get it. I work in one. Hospitals stretch ratios and call it efficiency. Patients feel it. Providers feel it. Nurses feel it every single shift. And I am definitely not saying that hospitals are saints. They absolutely want to save money wherever they can. But hospitals aren't the ones with the most power. You know who is? Health insurance companies are. Insurance companies decide what gets approved and what doesn't. They decide how long someone's allowed to be sick. They decide whether care is considered medically necessary, often without ever meeting the patient. And something people don't often talk about enough is this, which drives me insane. Reimbursement rates are not universal. So what does that mean? They're dictated state by state. That means the same care, the same diagnosis, the same human being can be valued very differently depending on what state they live in. I practice in Rhode Island, and while people don't always realize it, Rhode Island operates in one of the lowest reimbursement rates in the region. Providers here are reimbursed significantly less than neighboring states like Massachusetts and Connecticut for the same services. And this is especially true in mental health. So when people ask, why are there fewer beds, fewer providers, longer wait lists? This is kind of part of the answer. Mental health reimbursement is at historic lows, yet we're sicker than ever. At the same time, insurance companies' profits are at an historic high. How is that okay? We're constantly told there's no more money, no money for staff, definitely no money for long-term care, no money for prevention, no money to keep clinicians from burning out. But somehow there's always money at the top. Gotta love that. So where exactly is the shortage? Because it's not happening in the executive offices. Insurance companies aren't passive middlemen. They actively dictate care. They use authorizations, denials, and delays to control costs, and they call that utilization management. But let's be honest, that's care rationing, only it's quiet, it's bureaucratic, and it's kind of hidden behind paperwork. Patients don't see it. They just hear, your insurance won't cover that. Providers see it, and they burn out fighting it. And nurses are left holding the emotional wreckage, trying to explain denials that we didn't create. And somehow we've normalized this. Why do we accept that corporations, whose primary responsibility is profit, dictate healthcare outcomes? Because insurance is not healthcare. It's a business, and a wildly successful one. Where is all of the outrage? When care is denied, they save money. When care is delayed, they save money. When providers give up fighting, they save money. And guess who pays? The patient, sometimes with their health, sometimes with their life. There is a deep sense of helplessness that comes with this work. A feeling that no matter how hard you advocate the system is stacked against you. That even when you do everything right, the answer can still be no, because an algorithm said so. And that's where it starts to kind of feel a little dystopian. At what point did we decide healing should be optional if it cut into profits? And how did we allow insurance companies, who never touch patients, to become the most powerful players in healthcare? How did that happen? Where are our politicians when we need them? And then we're told, yeah, this is just how our system works. We're told there is nothing we can do. We're told to accept it. But maybe the real problem is that we stopped questioning it. Because when you step back and really look at it, this doesn't feel accidental. It feels engineered. It feels intentional. And maybe that's the most unsettling part to all of this. And it's about refusing to pretend that this is normal. Because once you start questioning who holds the power in healthcare, you start seeing the system for what it really is. And that's where change always begins.